Welcome to Pathways to Health, a podcast brought to you by the College of Health Sciences and Professions at Ohio University. I am Dean John McCarthy. Pathways to Health offers insightful journey into diverse health careers through engaging interviews with alumni and friends. We want to discover the realities of various health professions and the power of interdisciplinary collaboration in improving patient well-being. I'm here with Pam DeSalvo Landis, and I'm thrilled to have this conversation today. One of the things, Pam, that's been great to talk with alumni about is really their path. And the people that I'm talking to have a path that ended up taking them to healthcare at some point. Um, but everybody's path on that journey is really different. So, my first question in talking with you a little bit was, how did you start out, and then how did you end up in healthcare?
Great question. Thanks for asking me to participate here, Dean. Um, I started at Ohio University as a journalism slash pre-law major. Um, my mom wanted me to become an English teacher. I didn't want to do that. And so I came to OU I was going to the expose all the truths in the world and use that as a platform to do that. And I actually worked as a journalist after college, and I loved it. And I realized then, after working in journalism for a while, that I probably wasn't cut out for it because I was more opinionated than a fair and accurate and objective journalist needed to be. And I had a lot of opinions about how things should be. And so I worked in politics and democratic politics for a number of years and really worked on the communication side. And one day I was working in Washington, D.C. for a liberal interest group, and we were working on the first healthcare reform bill in 1993. And I became really interested in healthcare. And I was fascinated by the policy work being done and the discussions that were happening. And when healthcare reform under then First Lady Clinton failed in 1993, I realized that I loved healthcare, that I could not work in Washington anymore because I thought it was a gutless, soulless town. And apparently, I'm still right about that one. So I lived in Baltimore, Maryland, and there was a job to do PR and science communication for Johns Hopkins, one of the great hospital and research institutions in the world. And I was exposed to some of the most brilliant clinicians, researchers, and scientists, people who literally had Nobel Prizes. And I became fascinated with healthcare, and not only healthcare and how it's delivered, but how hard it is for people to access it. One day, my boss leaned out, and I was working in the PR and clinical communications office. He leaned out and he said, "We really need to figure out this World Wide Web." And that was in 1995. And I raised my hand. I said, "Well, I'll do it," because the server for the department was in my cubicle. And from there, I started to teach myself all about health IT, which was a burgeoning industry, and the web was burgeoning. And I learned all about that. And I've been doing that ever since. The reason I stay with it is because my passion is, how do you make healthcare easier to access and manage? It's too hard. It's a labyrinth. You have to know somebody who knows somebody who can get you in to see somebody when you want to be seen. And that's actually terrible. And so I want to use the skills and the foundation that I got from Ohio University to make a difference.
Wow, that's great, and I love hearing about that pathway in there that also weaves through some of the technology advances. And so, y you also got to see not only the internet and those connections, but then also kind of the mobile world and how that worked in too. Was that something that you ended up being a part of as well? The mobile
The
application?
feels Exactly, because it's all about how do you make it easier for people to access and manage their care, and make it easier for the clinician delivering that care to be able to do that.
Right.
And you've got to keep up with the technology. Over the years, overseeing the installation and the configuration of electronic medical record systems, revenue cycle systems, mobile solutions. I always tell my bosses the most expensive real estate in the world is not the building or the hospital they want to build or the practice they want to build. The most expensive real estate is that person's phone.
Wow.
If you can get on somebody's phone and get people to access you via their phone, you've got them. It's a really profoundly intimate experience when you are holding it in your hand. It is a different experience than if you're standing at a computer, a workstation, or if you're looking at your desktop. The mobile technology has changed how we deliver and access our care.
Yeah, and I was thinking about that in the realm of telehealth services, and I guess I just wondered if you could talk a little bit about how you've seen that evolve. You've seen the technology advance, but you've also seen some of the policies kind of try to keep up with it too. I wonder if you could talk about that a little bit.
Yeah, so we actually at Hackensack Meridian Health have really been involved in the deliver using technology to deliver care virtually. So we actually have active hospital at home programs at several of our hospitals. People, instead of being admitted to the hospital, we actually turn their home into the hospital room so that they can get treatment and recovery in their own home. And we're sending the clinicians into those homes. Now, to do that, it's not that it's cheaper, it's just that it's better. It's better for the patient. But we rely on Medicare being okay with paying us to do that care in that home. And in our recent congressional, debates, a lot of virtual care are in those budgets. The ability to pay for hospital at home on the video visits, for your, upper respiratory infection or your earache. Those are all in that federal budget. And we are always in pins and needles every time we're waiting for Congress to act and pass a budget.
Yeah.
So we waited through March and they extended it to September. And on September 30th, we'll be saying, will these be extended? The technology's there and it's ready, but you have to actually be able to pay for it and for payers to pay for it. Just because that clinician is delivering the care to you virtually doesn't mean that it's less care. And a lot of times it's better care.
Yeah, the first time I met you, I still remember something that you said, and that was that people want excellent healthcare, but they don't want to pay for it. And it sounds like you do continually run into that challenge.
What it is so nobody goes out there and says, I want cheap health care.
Right.
I want the best health care. But what they want is to be able to their insurance companies to cover it and afford it. I will say that what we see in our patient population, convenience trumps everything.
Yeah.
I want to be seen when I want to be seen, and that might mean now, it might mean tomorrow, it might be 3 days from now, but patients, wanna be seen when they wanna be seen. If they're sick today, they wanna be seen today. And that's what we mostly encounter, and that's what we try to deliver on. And if you're an inpatient, if you're in one of our hospitals, you're not really worried about the bill. You're worried about the quality of the care and the communication skills. Like, do you understand what your doctor's saying to you? Do you understand what the nurses are explaining to you? Do you understand your care plan and your treatment plan? Do you understand what you're going to need to do when you go home? That's the stuff that keeps us up at night.
Yeah. Yeah, absolutely. And it's something that I hear from all the different healthcare professionals in my college too. I
Mhm.
wanted I wanted to come back to something you said before because I'm always interested when people get kind of these personal insights, and as students too. And you talked about being opinionated, and it that's consistent with my experience with you so far. But how? And I think it's a good thing though. And I guess I just wondered, like, you had that insight and said, "Hey, that trait I have is not serving me well in this particular career." How have you made that an asset, in the work that you do now?
So what I do is I want to be an advocate for patients. That's basically what it's all about for me. And I went through personal health challenges when I was in my late 20s, and I actually was really, really lucky. I got great care. I had great access to care. I had excellent insurance. I had excellent family support. Not everybody does.
Yeah.
And that's what, the realization to me was I was lucky. I was really lucky. And so my job is to always be an advocate for the patient in all of these settings to make sure that their voice is heard. And like sometimes that means I'm bringing patients in to talk to our developers and to talk to our analysts and to sit down and say, this is what we are going through. I also require my team to spend time in physician practices and in hospitals to observe how care actually gets delivered here. And, when you're building something or deploying some new software, or you better understand who's gonna use it.
Wow, that's great. Um,
But advocacy is more the empathy for the person that we're trying to serve. That's what I just, like, said. What does the patient need?
I think that's such great insight because I try to talk to students about the importance of advocacy, and I think their view of it is it's something completely different from what they do in their regular job, when the reality that you're describing is, no, it's an extension of your care for people, and that's why you're saying the things that you're saying, and that's why people are gonna listen to you, because you actually do have that, you've had that contact, with the patient.
Right.
Yeah.
Yeah, I mean, I just fear it's our job to always keep the patient in mind. Um, and maybe that means it's what we're developing. It doesn't work for us as much as we want it to, but boy, it's going to work for patients. You know what? We're going to do it then.
Absolutely. Uh, I wanted to talk about another thing that comes up with healthcare providers, and especially more recently, and it has to do with burnout. And I just wondered if I could get a little bit of your perspective on how do we manage that? What's the scope of this problem, and kind of what are some of the drivers of it?
Mhm. So I worked here during the pandemic, and New Jersey got their first COVID patient on May 3rd, and they ended up at one of our hospitals. New Jersey got hit hard and fast, as New York City did. I mean, it was a pretty challenging time. We were lucky in that our providers always had access to PPE. We always had supplies. We got great support from our board members and our community. We had board members who were like, out there, calling up the owner of the New York Giants, say, "Can we use your, plane to go pick up supplies?" "Yes, you can." Um, it was a moment in time that it was the scariest time, but it was an absolute privilege to work during the pandemic and serve the communities and the people in those communities. It was what we were built to do. And our clinicians and from the nurses and the environmental services people and the dietitians and the food service people and the lab people. They were going into those hospitals every single day without knowing if they were putting themselves at risk and their families at risk. So for me, they are like the greatest heroes I've ever seen. It was a privilege and an honor to support them in every way. But the world changed, and it
Yeah.
changed our personality, and it changed in a way that it was really challenging for people to come out of that pandemic. There was some real scars on the souls of people, and it's kind of it's been a it's been hard on the people who are our patients, who are fighting against every piece of science that we have, and it's also been hard on our clinicians too. There's this psychic, feeling. However, um, they come in every day and they do the work. It's not like it was like in those early days of the pandemic. They are still coming in and doing the work. And there is a lightness that is starting to emerge in healthcare. I will say it's hard though. I'm not going to tell anybody that this is an easy profession, but it is absolutely the most inspiring and rewarding thing I've ever seen in my life.
Wow, that's fantastic. And I think when I hear students who come in and they say, I'm interested in this career because I want to help people, um, being able to say what fuel that is, to come in and do challenging jobs every day, when you feel the significance of your work and we feel the impact of your work, I think that can make a difference, and I think it's a good mitigator for some of these, competing challenges that people have. Yeah, thank you. Um, you gave some great examples of the complexity of a healthcare team, and I know when people come to the College of Health Sciences and Professions at Ohio University, they may be thinking about one specific profession they wanna be in. I wanna be a nurse. Well, I
Mhm.
want to be a physical therapist. And sometimes you don't always get that complexity of everybody that's on a healthcare team. I wonder if you could talk a little bit about how you see yourself fitting into the complexity of a healthcare team. And do you, when you talk about what you do, would you say, I'm a health professional? Is that how you see yourself fitting in?
So I would say in my role in doing healthcare IT work, I am the support team behind them.
Yeah.
They can't do the work without the IT work underneath, but I am there to support them and the patient. For those people who are looking at a really direct clinical role, I think you should do it. It is the most like I am so sad that I never took chemistry and avoided it because I think I'd be a really good nurse, but I just didn't have it in me. It is a great thing to do, but I would also say to students, don't limit yourself to the idea that you're going to be a nurse, you're going to work in a hospital, you're not going to work anywhere else. Your career will evolve. So make sure that you get the foundation of a couple of things. Make sure that you have some business classes under your belt. Make sure that you have some communication classes under your belt because all of those pieces will come together to help you in your as your career progresses. Because where you start is not going to be where you're going to end up. You might start as a nurse and you might end up being the CEO of a health system, or you might be a board member for a startup for some diabetes monitoring company. But you've got to be ready for some of those things. They're going to hire you for your clinical expertise. They're going to keep you and you're going to grow with the pieces, the business knowledge, the communication skills, all of those other things, the sociology skills, the psychology skills. You're going to need all of it as you grow in your career.
Yeah, completely agree. One other skill I'd love to just hear your perspective on, that we do try to instill in our students is related to critical thinking. And I wonder if you could just talk about that as a foundational skill for a minute.
Yeah, absolutely. So when I went to Ohio University, what I learned was, and I got a foundation, is critical thinking and analysis. And that's what's really important. To be able to, you're going to get as a clinician, you're going to be bombarded with data, just bombarded. And it's going to be screen after screen of data. But what you're going to have to do is really think thoughtfully about it and to really actually be able to analyze it to make the best informed decision. Data is a point, and it will help you inform your decision, but it will not be your decision. And even with the advent of AI, you actually have to have critical thinking skills to evaluate whether the response you're getting from AI is a good response. The tools are all getting better, but it's never going to replace the fact that you have to be able to discern what you're doing and thinking about for your patient.
Yeah, and we can even come all the way back around to that idea of now with mobile devices, just how quick it can be to get access to some data, but you've always got to be thinking behind where did this come
Yeah.
from, and yeah,
Tell your students to like look at the current discussions that are going on about, measles vaccinations. And people are saying, just take vitamin A. Well, if you take, here's a kernel of truth to some of that, that vitamin A actually can help people after they've had measles. I don't know. But if you do it too much, you can destroy somebody's liver too. So you have to be able to, these devices are great purveyors of information, but they're also great purveyors of disinformation and misinformation. And you better have the skills to be able to tell the difference between the two.
yeah, completely agree, and we're always going to need that kind of human hand on the wheel. I think as these technologies roll out. So,
Yeah.
yeah,
And that's why patients want that human hand on the wheel.
yeah.
There's not a patient I've ever come across who has said, "Yeah, I'm really okay for an AI-powered robot to take care of me." Nobody no, you know? They wanna know that when you go into robotic surgery, that it's actually a doctor
Right.
manipulating the bot. Um, so patients actually want to be treated by people.
100%. And just how it really does come down to people then, and whether you're connecting people with providers or the people that work on a team, your work in healthcare IT connecting people up through whatever channel it is with the patients. So yeah, 100% agree. Can't really think of a better place to end, than on that kinda note, Pam. I just really, really appreciate your time and your perspective, and, I think just as a resource out to students, to hear, about all these different paths to get to a different place is so important. I think it's hard when you're 18 to just sort of trust that things are gonna work out, and there's a real need, I think I see in a lot of students to have a plan. Um,
So be okay to pivot. So, for instance, when I graduated from college, there was no such thing as the internet or even email. Like literally, these jobs did not exist. Um, be okay that what you're going to be doing in 20 years doesn't exist right now. But have the foundation in place that you feel comfortable with what we call in business doing the pivot, being ready to, oh, th- this is where things are going. I'm going to go there too.
100%. 18-year-old me did not see my future as a dean of a college of health sciences and professions. Um, but I love this job. And tracing the path here is interesting, but it's definitely not one I could have made a deliberate plan for. But all the pieces I picked up along the way serve me every day. So, yeah, it's great.
Very good.
Well,
Thanks
um,
for having me.
absolutely, Pam DeSavalandis, thank you so much for joining us here to share your story. I really appreciate it.
You're welcome.